coming to perform therapy. I have to be in the room. I have to do this, right? And it's not something that's about secretions yet, right? This is about positive expiratory pressure, right? So this is about them breathing against that resistor, right? And then they also have to then take a deep breath too, okay? So take a deep breath and then breathe out against this pressure. So this is gonna stent open airways too, right? So this is gonna be a great device. And then it also requires me to do it. Plus I can also connect a neb to it if I wanted to, if I needed to do that too, okay?
I thought a lot of hospitals don't have the easy.
Doesn't matter. You're in a hospital that has everything.
Oh.
You've got everything. You have it all at your disposal.
Okay.
Okay. So you can't think about that. Okay. You have everything that you need. You have all your resources.
Also, to consider IV fluids, do we need to really care about that? Because we don't give IVs.
Oh,
so should
sister.
the nurse be
You
knowing to do that?
are it. You are everything. Yes, you care about IV fluids. You 100% care about IV fluids. You care about antibiotics. You care about it all because you're going to do it all. Okay? Remember, you're in MBRC land. You give everything. You do it all. Plus, I thought I had pounded it into everybody's head that when we're talking about pulmonary hygiene, that we need to have good systemic hydration, right?
Yeah.
Because we don't want those thick, tenacious secretions, right?
Right.
We have to have good hydration. Yeah, so we do absolutely care. Yes, 100%. Yep. And you may not put in the IV. That doesn't matter. We want to ensure that they have it, that they have that good hydration. Okay, whether you're just given the order to put it in, okay, whether, doesn't mean you're starting the IV. You're putting the order in to do it. Okay.
Yeah, we can do that.
Okay. So let's see. What else do we want to do? Okay. Have we addressed his cough yet? Because remember, we got to be able to do two things. So, what's the first thing that patient has to be able to do? Take a deep breath and cough. Have we addressed that yet?
Heck no.
No, we haven't. Okay, so we need to assess the cough, right? Assess his cough. Assess cough or ability to cough, right? Because if he can't take a deep breath to cough, then we need to do something for that too. Right, so you don't need to say that what that might be yet, but just be able to tell me assess ability to cough. Right, or assess ability to take a deep breath, okay? Okay, now, there's also one other thing that we haven't done here, too, is because he's had recent surgery, right, he's going to be potentially in what?
Pain.
Pain, okay? So, assessing that pain, and is he mobile? Remember, we've talked a lot about mobility and how moving also prevents atelectasis, that mobility piece, okay? So we also want to make sure that we are assessing pain because that's going to prevent them from wanting to cough. So the pain piece is huge, right? And, okay, then also assessing for their mobility, okay? Because this we're talking about here, we're talking about risk of DVTs, right? Remember that piece? And so do we want to then talk about, what do we do for that? What are the couple things that we can do to prevent that?
What is a DVD?
Deep vein thrombosis. I know. And so if they get one of those, where is that gonna go? Go to the lungs. It could become a PE. That's why we care about that. Okay? So if they're not moving, they're not being turned, or they're not getting up and walking, that is a big deal to us as a respiratory therapist. I know it sounds like, why do I care about that? I care about that because if they're not doing those things, that becomes my problem, right? Then now that clot's going to travel to the lung, and they're going to be at risk of a PE, and then that is something that I have to worry about and deal with. That's why we care. It's just so crazy to me, right? Is it crazy to you that all of this goes together, right? This is not just, well, that's a nursing problem. No, the whole body is something that we have to worry about because it all works together, right? It's wild how much you're learning, right? You never thought you'd be worried about DVTs. I never thought I had to know about heparin. You do. What's it?
So, like, are you making them off, or are you just putting those things on their legs or whatever?
Yes, that's right. So those pumpers on the legs,
Okay.
yeah. And you can call them SCDs or ALPs or whatever you want to call, yeah.
Okay.
Or just tell me the pumper things that go on their legs, Dr.
Okay.
Krieger.
That's how I'll
I can't
remember.
remember what I'll call them, but those things that go on the legs, right? Or heparin,
Okay.
okay? So a shot of heparin or those pumpers on the legs, okay? That's a lot to tell me, right? Ooh, yeah. So if I ask this question, how would you make a plan for pulmonary hygiene?
Assess everything.
And that could be like a 5-point question, right?
Oh boy.
Ooh, that's a lot to tell me, right? Well,
And
that's a
heparin's
lot.
blood thinner, right? or something.
Heparin's a blood thinner, yes. Yes, ma'am.
So, since we're gonna have some of these on our test for the care plan, like, you want us to be this, like, how detailed do you want us to be with it? Like, what's acceptable, what's not?
Well, you should be making sure that you're addressing the ability to take a deep breath and a cough. So a lot of, this is what all this does, right?
Okay.
You're addressing the cough, you're addressing, the pain piece goes with they can't take a deep breath, right? And then you've made a plan for their IS, you've made a plan with your Easy PAP, you've listened to them so that you know, do I need to then do a duo-neb or add something with that, right? And you were talking about their hydration status because that impacts the mucus clearance, right? You're talking about, do they have an infection now because of the fever, right? So you've added in all of these extra pieces here, right? And then you've also added the mobility piece in here because again, that goes with all of it, right? That all gets tied together here. And you've ordered some, and I would even ask you that too. I would even add to the question, like, do you want to order anything too? I would give you some little hints. Like, can you make a care plan, a detailed care plan for the patient, including things that you may want to order for the patient as well. Okay, so I would give you a little bit of like, you know, leads and like, make sure you do this and this, yeah, not just flying blind. Okay, let's try another one. I've got a couple more here, okay? Okay, our next one is,
Wait, the orders were CBC and what's the?
oh, chest x-ray.
Oh,
Before I
Okay.
erase it.
You can erase it.
Okay, okay. That was close.
I did.
Woo,
It
that
was
was
really
close.
good on you. Thank you.
You're welcome.
Yeah, I couldn't go for the long.
You're gonna
one.
get really good
Yeah,
at these.
I'm-
looking at you today, but I'm like, it's something.
Thank you.
All right, our next one is a 55-year-old male on the vent 5 days. Now, don't worry that it's a ventilator. Don't let that scare you. And what does he have?
Thick heels, sputum,
Thank you.
and hoarse breath sounds.
All right. Okay, so we don't know anything about what's going on currently. Okay. This is all that we know right now. Okay. So what are we gonna do? You walk in, this is your patient in the morning, this is what you see. You've been given no report. All right, so the world's your oyster. And you wanna know, the physician says, you know, what do you wanna do for this patient? And you're gonna say, okay, well, I'm going to, your case here is just gonna be, what do I wanna order? I have nothing ordered for this patient. Maybe they came from an outside facility, okay? What's something you wanna order for the patient? Give me a med.
A med.
Yeah, give me a med. What does this patient need? If they have thick sputum and coarse breath sounds, a mucolytic? Good, what kind?
No, the other
other M1, Eucharist.
Mucomist. Okay? All right. How often do you want it?
Twice a day.
BID?
Yeah.
Okay. Now read. Fluids, okay. Okay. All right, good.
Like yellow is like sign of infection or no? Okay.
Mhm.
So CDC then?
Good. I like it. Jessica.
Chest X-ray.
Yes. You like that one. I do too. Always get it. Always get it. I always want it. When did they have it yesterday? I don't care. Let's get another one. There's always a lag in chest x-rays. Always. I want another one. Every 24 hours. Give it to me. Plus, I like to look at them. Thank you. I got so excited. I knocked off my jewelry. All right, what else we got? I have like 6 more things. Come on. Come on. Come on. Somebody. You cannot give just Mucomist. Somebody tell me. Nairi. Yes. Which one?
Albuterol.
There's so many. How often?
I don't know, 4 times a day?
Yes.
3 times
No.
a day?
More
4?
often.
More.
Yes.
Okay. 4 times a day.
More.
6 times a day.
More.
What?
Every hour?
No.
Yeah.
You said 6 times a day, but more. That because how often is
Every
that?
4 hours?
Every 4 hours. Q4. Thank you.
Okay.
Okay. Yes. On a ventilator patient, Q4.
Q4, okay.
They're sick, Q4, and with the PRN. I like it. Okay. They have secretions. What order do you need?
I said, so do we do the CPTs there?
Oh, I like that. I like that. You want to order for CPT? What kind of CPT?
Or I test them?
They're on a vet.
Oh, they're on a,
Yeah, it's okay.
so, the IPV?
Yes, I was like aggressive. Yes, IPV. Yes, and after you've done the IPV, after you've done the IPV, what are you gonna do then? To get secretions out.
Oh, suction.
Yes, good. I like it. And suction. I see a hand up somewhere.
Yeah, I was gonna say suctioning earlier.
Yep.
But it didn't make sense to me, I guess, because
Yeah.
I didn't know.
When they're on the vet, you have to suction. It's inline.
Oh, yeah.
Yep.
Okay.
Mm-hmm. Yep. There's something more you want to order after you suction, while you're suctioning. Yes. It's called a CNS. It's a culture and sensitivity, so that you know which one of something else to give. You're gonna get something else up here? Yeah, that's right. We don't know which one yet, right? Because it depends on this. Yeah, I heard somebody else say something that goes over here. I heard it. IV fluids and give it S. It's for swelling.
Give us another letter.
Yeah, steroid, yeah. So we're gonna give IV steroids. That's gonna work much better than, we're gonna get systemic ones. That's all I have. Yeah, so if this white blood count comes back higher than 12,000, we're gonna give that antibiotic. which is probably going to, because if it's yellow. I bet it is.
What is the CNS again?
Culture and sensitivity. Okay. That's all I have on that one. Okay, we got it. Good job. That one was easy. Easier? Easier? Yeah? Okay. All right, what's our next one?
Sixty-year-old male patient who has undergone a CABG type 4 and is unwilling to cough due to pain.
Oh, stinker. Who will not cough? So sad. Okay. Okay, so this happens all the time. All the time. All right. So what's the first thing that we can try? Splinting. Splinting, and we can do this with, we can try to work with what? Yeah. Mm-hmm. Work with the nurse with pain meds. So we can try to coordinate our efforts. So we have our care plan, timed with the nurse, and we can say, okay, can you give pain? I'm gonna come up and do my therapy, in about 20 minutes. Can you go ahead and give pain meds, right? Because what kind of pulmonary hygiene or recruitment strategy is a CABG? Do we know what a CABG is first? Okay, a CABG is a coronary artery bypass graft. So this person has had their coronary arteries have been blocked, usually by plaque. Okay, so like they've had high cholesterol, like usually this is dietary. It can be hereditary too. So there are arteries that feed the coronary muscles that wrap around the heart. They've been partially blocked, and so they have had to go in there and they cut out the part of the arteries that are blocked, and they replace them. So graft, they replace them with healthy pieces of artery that they've taken from the patient's other places in their body. It's usually the leg, it can be the mammary, so other healthy vessels they graft over them. And so times 4 means in 4 places. Okay. So when they do this, they actually will take a saw and they saw down one side of the sternum, and then they crack open the chest. And so then when they're finished, they close it, and then they wire close the sternum. So you can imagine it is a great deal of pain afterwards for the patient, and they don't want to make that compression to actually cough. So they are in pain. It is a painful recovery. So when they're recovering, they usually don't, it's not really a pulmonary problem. So they generally don't have secretions afterwards. So we don't really need CPT, but we do need to ensure that they can do the first thing, which is what? Take a deep breath, right? They need to take a deep breath. So what thing will I give them to make sure that they can take a deep breath? An IS, that's right. So they need an IS. That is their thing, okay? So I need to educate on an IS, all right? So they need that constant re-instruction, okay? So if they cannot do that, okay, do you need to come in here?
I'll just do it on my desk.
Oh, okay.
Yeah.
Okay, yeah, sorry, okay. Is it the time already?
Yeah.
Oh, man. Oh, I'm not gonna get through all this. Or
What time
I
you
can
gotta be
stop if I need to. I forgot. We have a meeting. I always do this. Okay, so that's gonna be what we're gonna give them is that IS. So we're gonna tell them, okay, hug that pillow, right? So then we're doing that, and then you're gonna take that deep breath in. And I do want you to try to cough if you, because it does make them cough, right? When you're gonna want to cough. Okay. So if that doesn't work and they won't do the IS, then what would I want to give them? If then they start to develop some atelectasis because they're not coughing. What device am I going to then want to instruct them on? Remember, post-op. The easy path, that's right. That's what they get next, is the easy path. Okay, that is their next thing. All right, you also want to make sure, of course, that you're ensuring, again, good fluid intake, right, with these patients. And what's the other thing here too? Because if they're not, they have to be drinking on their own, right? Lots of fluid. And what's the other thing that I want to make sure that they're doing? Yes, that too. Mobility. They have to be up and walking. They have to have good mood, which is why we're like, soon as they are able, as soon as they are off that vent, we're like, get up, let's move, let's walk, because that prevents atelectasis. And it gets that blood moving, that circulation going, and it speeds up their healing process. It is so important. But if they won't do that, if they're stubborn and they won't do it, then they end up with pneumonia. These are the ones that end up with pneumonia and they lengthen their stay, right? And if they still won't cough, boy belly, guess what they just bought themselves? You know it. You had to do it. What do they get? They get a cough assist, right? They get an MIE. Hey, guess what I'm bringing in for you? Here you go. You're gonna really wish you'd done that IS a couple days ago, buddy boy. Now I'm gonna be mean. And they don't like me. I'm like, well, now you have a fever and you don't feel good, and now I'm gonna be drawing blood from you, and now you're gonna get a chest x-ray, because guess what? Now you're on antibiotics because you have a pneumonia. Not sorry. It's not my fault. Okay, so these are all the things, right? But that's why I walk in and I say, listen, we're here. If you do this, this is your ticket home. That's why I say that to them. This is a fun little thing, right? And I feel like it should have like balloons or confetti should fly out of it, right? Because it's what's going to get them to go home fastest, right? And I love it, especially because this is a lot of times this is like your 50-ish year old gentleman, right? And if they have a wife in the room, I'm like, listen, this is what we're doing, okay? If they do this, this is gonna speed up the length of, because I know they don't want to be here. They never want to be here, right? And I don't want them here either, but this is what's gonna get them to get out that door faster. So then they usually are barking the orders, right? So I'm like, if you help speed this along, right? So, and maybe they don't want them home. I don't know. I mean, sometimes it's a little break. I don't know. I'm just saying. That's your part in this, is getting them to be able to do that. So, okay. All right. So we have, let's see, pneumonia. Is there one I wanted to focus on that was anything that was really big? Well, I'll talk about. I have all these written down, and I have explanations for all of them that I can post. I was gonna post this anyway for those that couldn't come because I have 3 left. But I think you get the idea. And I think there are 3 case studies, I believe, on the exam. So, if I remember correctly, there are 3. Because I'm hoping that you get the idea of when I say like, okay, you know, create a care plan for this patient, or create a pulmonary, it's gonna be like, create a plan for pulmonary hygiene, you know, for this patient, considering, you know, what's going on, and then also be sure you include things that you would want to order, and that's what I mean when I'm talking about labs or chest x-rays. So it's, you know, now we kind of know, like,